Committee meeting of Wednesday, September 12, 2018, North Broward Hospital District at Medical Center. Call up to order. Roll call. Ms. Alfaro? Yes.
Commissioner Gregoire?
Here.
Commissioner Wellens?
Here.
Commissioner Uri?
Here.
Commissioner Klein?
Here.
Commissioner Barry?
Here.
Any public comments?
No public comments.
Okay, approval of the minutes of the July 18th, 2018 meeting. They're under tab A in your booklet. Do I have a motion to approve?
So moved. Second.
All in favor?
Aye. Aye.
Thank you. Okay, on those minutes, I think you'll see some things that have been requested that do not appear on this agenda. And the reason was we were very conscious of the length that this meeting is going to be this day, sending us all home at midnight. I promise you that those things will be addressed at upcoming compliance committee meetings and board meetings. As far as the hotline, I've spoken to Mr. Hartfield, and he's revising the report so that he addresses all of the concerns that everyone has raised about the previous hotline reports. That also will be in upcoming meetings. Mr. Hartfield, new regional compliance manager?
Yes. So kind of going back to the topic that we were just discussing, I wanted to introduce a new member of the compliance department staff. She started August 6th of 2018. She is a regional compliance manager assigned to Broward Health North. So essentially she is kind of her job responsibilities is she's kind of the compliance officer for that hospital. So she spends some of her days in the office of corporate. She spends some of her days up at Broward Health North. She was there this morning, then drove down here for this meeting. Just to give you a little bit of background on her, previously, before coming to Broward Health, she worked for Envision RX Options as a compliance analyst. She attended the Ohio State University, I know that's important to some people, and received her bachelor's degree from Ohio State University, and then received her law degree from the Cleveland Marshall College of Law at Cleveland State University in Cleveland. She is also certified. She's certified in healthcare compliance as well, and she just in the short time that she's been here, she's been a great addition to the compliance staff. It's been an excellent addition. So I wanted to introduce Deanna Nikolazakis. I apologize if I said the name wrong.
Welcome.
So, and then flowing into that, I just wanted to give everyone a staffing hire update. We currently have several positions posted within that are open positions within the compliance department. And one of the positions is a senior compliance specialist position. I recently redid the job descriptions for both. We had two different senior compliance positions in the department when I came in. The job descriptions varied wildly between the two when really they should have been doing the same amount of work. So I updated the job descriptions to make them consistent for both positions, and recently reposted the position with the new updated job descriptions for the job responsibilities. Essentially, the idea behind those positions is to, instead of having, like with Deanna, she's responsible for compliance issues at Broward Health North, the senior compliance specialists would more work on system-wide issues, right? To where something that would affect not just Broward Health North or not just Broward Health Medical Center, but something that would affect the whole system. They would be in charge of kind of coordinating that, ensuring that meetings are being scheduled, addressing any compliance issues within that, and kind of being the point person for system-wide issues. The job's been posted. We already have a candidate identified, and I'm hoping to have an offer out by the end of this week for that position, and hopefully she'll be able to start by the end of this month. Another position that I'm just waiting on to get posted because we again updated the job description to reflect the current structure of the compliance department is the Director of Compliance Operations and Privacy. That position, I redid the job description. We submitted the request for it to be posted. They did a review to make sure that, everything fell with, whatever grade it fell into and everything like that. And I believe we'll, get that position hired relatively soon. So I'm hoping it'll be posted this week and start doing interviews. Also another position that we, as Alan talked about, we were talking about different positions within the department for the budget. And one of the ideas that we'd come up with is that we feel that our policies are kind of lacking in regards to oversight and structure, and that we want to create a central policy committee and then also have a position that would be over policies and training. So the compliance department currently has a training specialist position that's been open. So what the plan is to upgrade the job description and make them responsible for policies and training, since really, updates to policies really do flow to training, right? So, when you update policies, you need to ensure that the people get trained on whatever the updates are to the policies and that people are knowledgeable of the updates. But then also we need to ensure that this position would then be kind of the gatekeeper for policies and procedures, right? So if someone at Broward Health Medical Center wanted to create a policy, it would all go through this one person. And they would start with kind of the basic idea of, here's what the idea of someone wants to do. Do we already have any policies that are duplicative of that? Right? Would it make more sense that that whatever they want to put in policy be added to one that is already in existence versus creating a new one? Or is this policy contradicting any other policies that we have in existence at this point? One of the things that we've seen is, right, so Broward Health Medical Center and Broward Health North are both trauma centers. So any trauma policy should apply to both facilities, right? Unless there is something unique about Medical Center or unique about North, all those policies should be the same. So I'll be updating the job description on that position and posting that as well. And we also have a compliance analyst position that we've been interviewing for, and we'll be making an offer for someone this week after we've done the interviews. That position is more, I redid the job description for that one as well based on current needs, so I didn't have to add to staff. So I have a HIPAA privacy person who's over our HIPAA, and I have an ethics person that I talked about earlier that came in when compliance took on ethics. Both of them right now are very overwhelmed individuals with a lot of work. So in an effort to not add to staff, I took the compliance analyst position, which had previously been in charge of kind of it's essentially just, the position was essentially for just kind of monitoring reports, stuff like that. I shifted those responsibilities to other people in the department and changed the job description to assist the ethics manager and the privacy manager going forward, to hopefully not have to add to staff. Hopefully by this person being split between the two of them, that will be enough of a relief for them to where they can start focusing more on proactive instead of being purely reactive at this point. Because we need, in regards to conflict of interest, we need to update a lot of things, right? In our conflict of interest and our financial ownership disclosure process, we need to update the policies, we need to update the forms. And right now my ethics manager just isn't capable of getting to it with all of the disclosures she has to review in regards to every contract that goes through the system, or any sponsorship that we do.
Sorry, when
Yep.
you refer to policy, are you interchanging that with procedure, or?
No, there's two separate.
Okay, so I want to understand, I guess, the distinction between this body's responsibility for setting policy versus your responsibility for establishing procedures. What do you mean when you say we're going to hire somebody to set policy, review policy,
Broward
update
Health policies and procedures.
Well, there's procedures and then there's policy. When you use the term policy, I want to understand what you mean, because that's really this body's responsibility.
You mean standard operating
Well,
procedures?
No. If I
No.
may, just because it's a charter issue, Nick, if I may, just from the charter, I think
Sure.
I know what Commissioner Yuri. So what you're saying is that the board sets policy, the overall strategy and the overall policy. These are operational policies that are compliance policies. There are some policies that are in the board's purview, like the 119, the minutes, but the policies that Nick is talking about are nursing policies, risk policies, compliance policies, but they're not the board policy making authority.
Finance, risk, all of that.
All right, the reason why
Quality of care.
All right, the reason why I'm bringing this up is I've gotten just over the last few years a great deal of, let's just say, confusion from folks that are employees here about what are, we hear about policy. Where is the central database of policy? How do I know I'm following policy?
Right.
And then this catch-22 of, if I don't follow policy, well, that's a great reason for termination, right?
I think that's what Nick is trying to address. I
Right.
think
Well,
there's
Yeah, and we're trying to address that issue with the creation of
and
this
create a
position.
data bank so
Which
that
is
it's all
We have to
consistent.
oversee it.
which
And
is
we do have
spectacular,
policy
but
staff.
I want to understand the distinction between this body's responsibility for setting policy versus what you're talking about. Because I just want to make sure we're doing our job and you're doing yours.
Right.
You know what I'm saying?
Yeah, and I'm
Right, this is a really good idea. This is something that we need, because we have policies beyond policies.
Yep.
So I'm in
I mean, how many
support of
policies
this.
do we have? Because I will tell you that what I hear
hundreds
is
more.
I've heard
I
thousands.
don't know. I was going to say 1,000, but I'm not
I
sure.
think. So
And
this is
it's-
a good
it's
thing
just
for us.
unwieldy, and so there's a reason why I'm asking the question, and it's not just to be a pain in the ass. Okay?
Right. No, I don't.
It's because I want to understand where that job of this body starts and stops, because I don't like the idea that there's this ambiguity over what the policies are
Right.
and whether or not people are following them, and then, let's be crazy that people actually know what the policies are.
Right.
And they can actually go someplace to figure out what that policy is.
Yep.
Right? Because I can't tell them, and I don't like that. You know what I mean? So when
Right.
I hear you use the term policy,
Yep.
I want to make sure we're all on the same
Right. These are
page.
operational
We don't
policies.
I don't need to nail that down this moment. I'm throwing this out there so that come very soon, maybe we just have some type of a compliance workshop or compliance committee meeting or something where that issue alone is understood better.
Sure.
Because I don't want there to be confusion over what our job is versus what your job is.
Right.
Nick, anything else on that?
No.
And I think what Mr. Hartfield is talking about are the policies that exist in the different areas, the different districts, the different facilities, and they govern the operations of the people in that facility, the nurses, et cetera, and they're different. North is different than medical center,
Correct.
and there isn't any central database at the moment, and that's what's going to be created, and that will lend itself to consistency, and so that everyone will know where to go and what they're responsible for.
Well, and we do have a centralized database, but I just don't feel it's being fully utilized.
Right.
And that's what this position will address.
So there is some central place
Correct.
where you can say,
Yes.
these are our policies,
Correct.
and here are all thousands of them are.
I couldn't say that those are all of them, because that's one of the issues that we're trying to address with this position, right? So I do think that the hospitals have policies that they have not put in there.
Then it's not a policy. Right.
We'll fix that.
Right, but
Well,
that's the point of
I'm not
fixing.
trying to be difficult
Right.
here.
To
but
address-
when I hear,
to address
when I
your
hear
concern.
policy and govern used in the same sentence, I feel like this body needs to have a considerably better grasp of where our responsibility starts and stops, and then
Okay.
where yours and the rest of management starts. Does that make sense?
Yeah. I mean, maybe we redo the training that we've done for the board members in the past.
Well, I'm
That
not
they
talking
kind
about
of
training.
that outlines.
I'm
Well, no,
not
but that training goes through and outlines the responsibilities of the board
I think
versus
the
staff.
training is twofold. It's not one way. because I don't feel like you can answer that question any more than I can. You know what I'm saying? So I think we need some help here. Because I'm just telling you what I hear, okay? And what I hear is this is an unwieldy policy
Completely agree.
thing that has to be addressed appropriately.
Yep.
Probably skinny down, be measurably more
Oh,
consistent
absolutely.
across operating units.
Yep.
Easily accessed and so on.
Completely agree.
Right, so with the addition of these people to your department, you will be fully staffed and you can address Commissioner Berry's concerns. And your
Yes.
budget is appropriate for the addition of these.
And we're still searching for 2 more regional compliance managers to fill that out as well. Those are the other 2 spots that are open.
Okay. Now, 4 and 5 are for me to deal with. Do you want to handle number 6 OIG letter right now?
If you want to. Sure.
Please.
So I just wanted to advise here at the committee meeting that we received a correspondence from Laura Ellis, our monitor, in regards to our annual report that we submitted in December of 2017. So this was her initial letter back to us asking for additional information, questions that she has, comments that she had. The difference between this year and last year, last year after we submitted the first annual report in January of 2017, she came down in person at the end of February. I think it was last week of February, first week of March, it blended over. I think Commissioner Uri, I think you were the only one on the commission at that time. My recollection is I think she met with every commissioner, she met with myself, she met with Lynn, she met with senior leaders in various departments and gave us her feedback and comments and questions in person last year. So this year, instead of coming in person, she sent the letter. And we're in the process of responding to that letter now.
All right, and this is the letter, just so I'm clear, that was sent just a few weeks ago in
Correct.
August.
Yep.
All right, so if we're on that subject, where I was concerned, I want to understand what happened between the filing of our annual report,
Yes.
and her correspondence. Because in her correspondence, it sounded to me like there was something that was supposed to be in our report that wasn't filed in our report, or it wasn't filed timely. And I'm just reading between the lines. She seemed kind of ticked off.
Yeah.
I've met with her. I've spoken with her. I don't want to tick anybody off in her world, but especially her.
Yeah.
Right. And so I want to understand what happened between the filing of our annual report and this letter, where she's clearly not happy with some deficiency in our filing, because I never heard anything about that. And I did call Ms. Capezzo to express my displeasure, and I was further displeased with the fact that she didn't know about it either. And I'm just trying to understand how from December, January, whatever the time frame is, and August, all of this time goes by, there's deficiency, and we've got a ticked off monitor, and nobody that you report to knows about that. I don't understand how that can happen.
Well, what had happened was with the January 31st deadline, right, that's in the letter, that was a self-imposed deadline that I wrote into the annual report based on the information that we had at the time, right? So the compliance department is responsible for doing a review of the arrangements database. So each year. Last year, as I talked about in the annual report, we were transitioning to a new contracting platform, right? So doing a review of MediTrack made no sense in the second reporting period, because we were supposed to transition to Compliance 360 in January, in March, then in June, and then in August, right? So it made sense to do a review of the new system to figure out what vulnerabilities we had in regards to that new system. So based on the information I was provided at the time by the procurement and contracts department, that would all be, everything would be in and done, and we would be up and running and smooth by the end of the year, by the end of 2017. So I put in the annual report that we would do a review and by January 31st. That didn't happen. Like, and I'm talking about with the contracts, right? So we finally get up and running a little bit, and then the process changes in January, right? So the workflow of it, everything changes in January. So I delayed doing it until July and completed the review in July.
What process changed?
The contract flow process. So like the workflow of how everything was linear previously, right? So it went from step 1 to 2 to 3 to 4 to 5. And in January, the process was changed to where it went out simultaneous, to where departments could work. To where departments could work.
So that happens.
Yep.
That's fine, but communication. So I'm going to assume that Ms. Ellis, between our filing, her expectation of getting some report from you by January 31st, and her correspondence, which was, I think, dated August 10th, and then there was a phone call, and then there was some response from you. Was there no communication with Ms. Ellis? Because I know there wasn't any communication here about when, and this is where I get concerned when you say my self-imposed deadline.
Yeah.
I think it's great. I mean, we all want to hold ourselves to whatever standard, but this is not something to mess around with, right? And when we self-impose a deadline and we don't discuss it with people that we report to, whether it's this board or Ms. Capasso, okay? And then time goes by and we have somebody who's a very important oversight person, and she gets ticked off. I'm gonna assume because there was no communication. I don't find Miss Ellis to be an unreasonable person. I don't find
either.
this board to be unreasonable either, any more than I do Ms. Capasso. But when you don't communicate,
yeah,
that's not how best to do.
Yeah, I agree. And that was my fault, and I take responsibility for that.
Okay, but where I'm growing concerned is not just communication with Ms. Ellis, but communication with this board and Ms. Capasso, because I'm really concerned about the fact that you didn't communicate with her either, or any, to my knowledge, at least any member of the staff. So this is a paramount thing and something that we are holding everybody responsible for, right? Including senior management. And the communication has got to be there. And I don't want to bring up the past, okay? But for those that weren't here, I was. And I know how insanely frustrating it was to not feel like there's that transparency, forthcoming, especially as it relates to compliance, okay? And you can probably sense my disappointment and frustration because I feel like we've gone backwards in that space, and I don't like that feeling. And I think you're generally doing a fine job. So I'm not trying to pick on you.
No.
I'm just trying to be as crystal clear as I can. This can't happen going forward. And I'm very concerned about the concept, okay, that your reporting requirement is only to this body, okay, because that is not my understanding, okay? And I asked you this before, and you had kind of given me a confused look. And when I found the lack of conversation and discussion about this issue with senior management, or other members of senior management, which you are, okay, that concerned me, especially as it relates to compliance, okay? And I don't know what it is you need from this body to clarify, but my having been part of that discussion and part of that very frustrating time and part of that vote to add a reporting requirement, it was not to remove a reporting requirement. It was to add a reporting requirement, okay? And if you need some clarification from this body, we will
That's
do
not
that.
accurate. That is not accurate.
Hold on.
It is to move the reporting requirement to the
Okay,
commissioner.
you were present,
I wrote it.
Well, I'm just telling you that I was present too. And I don't personally believe I was supportive of, in fact, I know I wouldn't have been supportive of removing the report. I don't know how an organization like this could possibly run without some reporting requirement from a compliance person. I wanted to add a reporting requirement because I wanted a direct responsibility to be forthcoming to this body for the duration of the CIA. Okay, so this idea that we're going to have a brief period of time where the chief compliance officer reports to the board only, and then we just have a line in the sand that in the future where that whole reporting requirement changes, it doesn't make sense. So if we need to clarify that, I'm happy to do it. I'm just telling you, being
I think
personally part of that
It
vote.
was very
because
clear in the resolution.
that was my recollection
So
as well.
what the board, for the board members who weren't here, what the board clearly did was to remove the reporting requirement to the CEO under the bylaws, clearly said it was being vested in the board for the period of the CIA. The discussion around that point with the resolution that was drafted and passed was that in the interim, if the board governance committee and the board as a whole decided that from that after the CIA, that the chief compliance officer would report to the board, then a bylaws change would be recommended and made. So it was not a dual reporting requirement. It was a direct report to the board that was approved.
Okay, I don't
By Laura
want, Ms.
Ellis.
Barrett, I'm not interested in relitigating the
I just
past.
wanted to
So
make
that's,
the facts as
that's
accurate as
not, that
possible.
wasn't what I felt would have made sense. If I didn't completely understand, my bad. I'm talking about now going forward. I do not, I'm not a healthcare professional. I'm not in multiple organizations. Mr. Berry may be more knowledgeable of that. I don't know how this organization or any other healthcare organization can function with a substantial part of their responsibility and the tremendous risk that comes out of compliance, where there's no reporting to other members of senior management, at least in terms of responsibility.
Jackson Health System does.
So
That's how
Jackson Health
Jackson
System
has their chief compliance officer reports to the board.
I thought, and I don't have the bylaws in front of me, from my perspective, from the day I went on this board, is the purpose that the chief compliance officer and ethics officer reports directly to this board is to have complete independence from our compliance department, direct report to the board because of the problems in the past where the compliance officer, who has a set of responsibilities under the CIA, but also under all kinds of regulatory reasons, is reports to the board so that you have a direct report to be independent of the organization, just as the independent auditor reports to the board and not to the president, CEO, whoever that
Because
happens to be.
otherwise there's an inherent conflict.
100%.
That's why these are direct board reports,
Right.
correct?
So I don't understand the confusion on the reporting, because I think it's been pretty clear since I've been on this board, and I'm the second longest on this board, that the purpose that we move the compliance officer to be a direct report is to create that independence, right? And that's my
That was my
understanding.
Correct.
understanding.
So I have a slightly different take on this, because what is the process? What has your process been, or what does our policy say that when you get a report, how would you handle this on a typical basis? Because I think there's a question of Commissioner Gurry's raising the issue of communication. Okay.
Yeah.
So what has been your practice when you get a letter from the OIG or from the IRO, and it
Right.
comes to you versus coming to the general counsel?
And generally it does come to me.
Right. So what
Yeah.
would that process normally have been?
Normally we would review the correspondence that's received.
When you
start-
say just
like
when you
I
say-
would
okay.
review the conversation that was received. and then share it with senior staff
Okay, and
because they're going to have input into it, just like with our response to this letter.
right, and so
Alan and Gino are both participating in the response.
did
Laura.
you share this with the senior staff?
It was shared the following week, yes.
Okay, is that been your standard process of how you've done it in the past? Typically,
Yep.
no.
Yeah, we would share it with it. Generally, if I get it via email, I'll forward it as soon as possible. This came in via fax. I didn't have an electronic copy.
Okay, so when did you receive the fax copy of it?
The fax copy, I received it for something on August 17th.
Okay, and then,
Because then that's when I learned that there was a letter, right?
Okay.
So because it's dated the 10th, right? But we didn't receive it on the 10th. We received it on the 17th by fax,
Right.
and then received it on the 20th by mail.
okay, and then you reviewed it because this is a pretty big
Yeah.
document. I looked at
Yes,
it, I
it
read
is.
it.
Yep.
And how long did it take you before you reviewed before you shared it with senior staff?
It was on, I believe, Friday. The following week.
It was before because I got it, I had marked it up, Nick was on vacation, so it was a Friday, it came by fax at 5:20, I believe, everybody was gone. And I reviewed it, we reviewed it very briefly. On Monday, I had already marked up mine, he got it by mail, but it was in his office.
Okay,
I had mine, I talked to Gino about it, I think it was Wednesday, and when we got into your office to get a clean copy, to make copies.
That we received it, that the three of us received it.
I don't think so. No, I don't think so.
I don't know anything about any of that stuff. You guys,
Either way, it was within
you guys can hash that out. but-
has that been a normal time frame?
Well, let me.
Can I ask a question about that timing? Because this is something that's a source of confusion here.
Yeah.
The letter was dated August 10, 2018,
Correct.
from Laura Ellis to you.
Yep.
And it says via electronic and regular mail.
Yep.
You're saying you didn't receive it via electronic mail?
I did not.
Okay. Do we know why?
It was due to size limitations. So when I spoke to her because she contacted me on the 17th, because as you'll see, one of the items in the letter is asking me to set up a phone call to discuss one of the disclosures that I made
I don't have it in front
on
of
my
me, so-
on my annual certification. Well, one of the items was that, right? And she asked for me to contact her and set up a phone call. So she called me on the 17th, inquiring as to why I had not contacted her to set up a meeting. And I explained to her that I had not received any letter. So while on the phone, she attempted to resend the email. And when she did, she got a bounce back saying that due to size limitations, her email was rejected by Broward Health.
How large was the email?
It was over like 10 megabytes, kilobytes.
your
I don't know, I'm not an IT person, but I contacted IT that day and spoke with IT that evening.
So that's been cured. I mean, you're now allowed to receive large
IT
attachments.
told me that they couldn't cure it, that it's a size limitation, that it is. Gisela, and who's the director of IT, told me that.
So I spoke with Kathy Ross after
Okay.
Nick had told me that it was bounced back. I immediately got up, told him I'm calling Kathy, she's our CIO, and said, doesn't matter what they send from the OIG, any of the addresses or anybody sending it to them must go through, you must push it through. Because it was very concerning when they said it was, we actually flipped out.
Absolutely.
Kathy Ross had said that she said that she checked through it and that it shouldn't be bounced back, that anything from that address to or from should not be blocked at all. So
Going forward.
All right. So now,
Yeah, it was
okay,
a
so
size
that's been
limitation.
addressed. But then
Yep.
the regular mail copy didn't arrive by the 17th either.
No, it arrived on the 20th.
Okay. And then you had a conversation with Laura Ellis on the 10th,
Yes.
right? And then that conversation.
Or the 9th. It was either the 9th or the 10th.
But did she say, "Hey, I just sent you a letter"?
No,
Let
she
me
said
know.
that a letter was forthcoming.
But did she sound ticked off?
She was upset about the January 31st, and we talked about it, and we discussed it.
So then you received the letter once you. So she didn't say when she was sending it when you spoke to her on the 10th.
I believe it was the 9th, but she told me that she would be sending it hopefully by Friday.
Well, your letter of August 17th says you had a phone call on August 10th, so I'm assuming it was August 10th.
Okay.
You had a conversation with her So you had a conversation with her on August 10th, and she said a letter is forthcoming, but her letter was August 10th. She didn't say I just sent it or I'm sending it today.
No, just
so
that she would be sending it today.
She would be sending
Yeah.
it today.
Yeah.
Okay, so you knew it was coming.
I assumed it would be.
All right.
But in the past, those similar statements had been made and I hadn't received anything.
All right, and then you received it on the 17th, and the copy I have is stamped received August 20th.
Yeah, that was a copy that was received in the mail.
Okay, so but it was
The other
received
one
by
has a
fax.
timestamp of the fax
Okay,
that says August 17th.
so what was then your protocol in circulating that? I mean, obviously this is saying there's 36 items in here saying you need there's a lot of follow up that's missed here. There's a lot of things that weren't addressed or that we need follow up on.
I think it's just her questions, yes. Yeah, I don't think.
So why the delay in circulating that? You know, to us and to staff, to council. I mean, why didn't that immediately get circulated? Saying, just want to let you know, we just got this letter.
Well, because I need to have time to review it first before sending it out.
Why do you feel that's necessary?
Because I would never want to send anything out that I haven't read.
Right, but we're the North Broward Hospital District, so this
Correct.
compliance obligation falls on us, on all of us.
Yes.
So it's addressed to you, but I mean,
Right.
I don't want to wait a week or two to see a letter from the monitor saying you've got a compliance problem.
But isn't
I don't
that-
think that's what it says, but
No, I think that he's.
I do.
I disagree.
Mr.
I
Chairman,
don't think
doesn't he
that's
have
what
the
it says.
ultimate responsibility as chief compliance officer for the system? So therefore, I think this is a 100-page document. You don't think it'd be appropriate to look at it before he distributes it?
And it
not
is
100
addressed
the
to
100-page document was
compliance.
his response.
It's addressed to compliance.
Correct.
And so part of Mr. Hartfield's responsibility is to review Ms. Ellis's concerns. And I don't think that there was an undue delay
It was a
in
10-page
disseminating
document.
this
10
letter.
pages, and then you have a lot of material back. But I'm saying, why would that be
Yeah,
an
but the
inter-
material didn't come
No,
from
this was
himself.
the-
I understand.
letter
So it's a
from-
10-page letter with 36 items.
Listen,
Why would it be inappropriate for him to review it
I'm not saying
as a
it's.
chief?
Hold on.
No. I'm not saying you are, but the chairman is raising an issue saying he thinks that it should have been distributed right away. I'm
Here-
saying he's a chief compliance officer. He has responsibility for the system. He reviewed the letter, and I think he distributed it within a matter of a few days.
And by the way, the next item on the agenda is my conversation with Laura Ellis, and I'd like to clarify how Ms. Ellis feels about this whole thing. So when we're ready to move on, I will be able to tell you that Ms. Ellis is not pissed at that.
Okay.
She may be at other things.
Okay.
Okay, and the reason why I ask about the timing is because the letter does say that the OIG expected a supplement to the second annual report on or before September 10th. So it's a pretty tight time frame to turn something around.
Right, and she gave us till the 17th to do it, because we didn't receive it until the 17th.
All right, but the letter said the 10th, so, you know,
Correct.
again, if I'm a council, I receive this, I immediately send it out saying, hey, we've got a deadline coming up, I'm reviewing it, I'll get back to you on what we think we need to do here. But heads up, you know, we've got like less than 3 weeks to.
Well, no, when I talked to her on the
respond.
17th, she told me we had until the 17th because we didn't get it until the 17th.
Yeah, I don't.
All right,
So, I mean, I understand that it says in the letter the 10th, but I have no reason to doubt her word in
So-
saying that we didn't get it till the 17th, so we have till the 17th.
Right.
to
So
respond.
let me just be clear. I didn't bring any of that. I wasn't really looking personally, at least, to get into. Although hearing the discussion does, you know, bring to the forefront some of the reasons why I was concerned.
Yeah.
Okay, because. And you were here, as I recall, and you're very familiar with what this board went through.
Yeah, I
with
sat through most of the meetings.
Okay, so for
Yeah.
example, okay, I respect that you want to read it. I respect that you want to review it. But the fact of the matter is, nothing that you would read, review, or whatever is going to change the correspondence from Ms. Ellis, right? So,
No.
right. So my point is, I think let me say this. My strong recommendation to you is that these types of things come in. It needs to get circulated, and it needs to get circulated. My own personal opinion is immediately, okay? And I say that I've forgotten about the deadline issue, and great, we got an extended 7 days. These things need to be addressed, and they need to be addressed quickly, but most importantly, at least as I read it, I sensed some frustration, some disappointment, whatever the adjective we want to use. That was my sense of it.
Right.
Okay, and I just feel like that type of, well, any correspondence, in my opinion, I'd love to hear good news too, just as swiftly. Okay, but it's not going to change her correspondence. Your review of it, no offense, doesn't mean anything to the actual correspondence itself. Now, when you send it, hey, just want to alert you, she's not happy about this, and here's what transpired, and maybe I should have communicated. However you want to do that, that's fine. I respect that. I would probably do the same thing. I think we need to be better. Okay, and I don't know. We can address it at a later date. But if the communication and the cooperation with senior management is going to be needed, right? I mean, a lot of the response requires people well beyond your department.
Absolutely.
Okay, I think that it's only proper that those things be communicated swiftly, and in a way that instills some level of confidence that things are moving in the right direction. That's for me. I'm just telling you, I'm not here every day. I'm responsible, but I'm not going to be putting pieces of the response together, right? It just needs to be better.
So, Mr. Hartford, who do you report to?
The board.
You can't report to the board. You don't ask all 5 of us for a day off. Who's your day-to-day?
Commissioner Gregoire,
Okay.
as chair
So-
of this committee, is who I would go to for day to day.
So between you and Commissioner Gregoire, have you guys talked about? This seems like a one-off to me. First of all, I looked at it. Miss Ellis didn't copy us. She didn't copy anybody. I've seen her other things, and she copies the board. So I would imagine when I did this for the state, I was deliberate in when I did things like that. Why you wouldn't copy the board, or why you would working with not-for-profits. In a healthy organization, in a healthy organization that's not under CIA, generally your position answers to the CEO, right? Mostly. You could take Jackson as an example, but Jackson's a whole another ball of wax. In most of the hospitals I work with, that person answers to. I like the idea that for the CIA you don't, that you answer to the board, but I think it needs to be specifically to compliance and to the chair of that department on a day-to-day basis. I think this is a one-off where this took, there were some issues as to why this didn't get to where it went. I think Commissioner Uri's right. It wasn't going to change anything. I do think you need to read it before you distribute it. If it says, excuse me, I'm going to use you as a bad example right now, Ms. Capasso. It says Ms. Capasso steal millions of dollars. You want to read that before you give it to her and have her intervene. I get that. But it should. I know it's a bad example. I apologize, but I'm from Detroit. That's how we do that. I think you need to speed that up, and that should have happened in the future. And I think at a minimum, I don't know when Commissioner Gregoire got it, but as long as she gets it, I feel pretty. Then I feel very comfortable there. I do think a quick review would be in order. It's not that long. It's 10 pages. You could read that in an hour, I would imagine. And it needs to be turned around. It just raises suspicion. When before I got it, I was anticipating something really bad. It's not great, but it wasn't horrendous. But it got the paranoia going. So I do think you need to do a little bit of a better job of turning that around fast. A week might be excessive. Again, I think it's a one-off. I think you're doing a good job. I think you have a tough job in a really tough environment. In the end, and going to Commissioner Uri's point, in the end, you're going to answer to the CEO of the organization. So somewhere along there, and I think Commissioner Gregoire has a good relationship with Ms. Capasso. I think this will work itself out. I look at the CIA and we're behind the 8 ball. Reading that report, I was hoping that we were further ahead. That report was kind of put us back still. I think your reporting responsibility, and this also goes for, by the way, for Mr. Crooks and for Ms. Barrett, that responsibility to the board has to be to somebody. Ms. Capasso asked Commissioner Klein, I'm sure. He's the chairman, so I would imagine that relationship is where it needs to be. Everybody else needs to have somebody on the board. You can't respond to the board and have all 5 of us say when you can take a day off or when you can't take a day off or how something should operate. And one of my agenda items that I put on, it might be was for the board meeting, was exactly for this. And something like this, I'm going to trust Commissioner Gregoire to say get it to Ms. Capasso immediately. I'm going to trust that she's going to give you some direction, that maybe she wants to read it first too before it goes anywhere, to ensure that there's nothing problematic going on, that we need to keep that clear. The monitor did not copy us, and I looked at most of her other correspondence, and she did copy somebody other than us. I don't know why she didn't copy us. Maybe because this wasn't that significant. It's a significant report. I don't want to minimize it, but it wasn't that significant. It wasn't some smoking gun.
Well, I wouldn't even say it's a report. It's a letter.
It took
Right.
a long time.
So she reviewed the second annual report.
Yeah, but you're saying,
and this is her initial correspondence.
yeah, her
in
initial
regards to that.
correspondence 9 months later. You turned that in, or somebody turned that in.
I did.
December?
Yeah.
You were supposed to do something by January. It took 8 months to tick her off. I mean, all of a sudden she's angry. She wants a response in a week. It took her 8 or 9 months. I don't see the sense of urgency that I would have assumed in that, but there is a sense of urgency for us. We need to be responsive to her quickly.
Absolutely.
You only have a month to respond to something that's pretty significant. You need to get senior management involved in that immediately.
And they are.
Read it. Well, they believe, it sounds like to me, they believe that a week was too long. They'd like it a little sooner. So you need to work on that. I think between you and Commissioner Gregoire, you can work on that. I think to clearly define the role and responsibility of what you have to do with Commissioner Gregoire is really important. Even the evaluation of you, it's another thing I have on there.
Right.
How we evaluate you, how we evaluate Mr. Crooks and Ms. Barrett needs to be defined better. And we need to do a better job as a board of saying, you don't just answer to the board. That's kind of nebulous. You answer to the board, but you answer through Commissioner Gregoire. I think it needs to stay that way, but I do think in our strategic planning session, we should be talking about where we're going in the next 3 years and how we're going to exit this. What do we need to do to make sure that we exit this? And some of this, and that will mean, when you read our charter, the internal audit answers directly to the board, the general counsel answers directly to the board, and the CEO answers directly to the board, but you don't in the charter. That was done for a special reason, the CIA. So eventually you're going to go back into the role that you need to go back into. So I would start making that relationship smoother sooner rather than later, and making sure that you understand where that's headed, I think. Today, I like the way it's running, I like the way it's operating, and I think it needs to stay that way.
Okay, anything else on that? Then let me move on to my conversation with Ms. Ellis. I spoke with her after all of this occurred on Friday, August 30th. And the first thing she said was that she's been working with CIAs for 15 years with the OIG, and I think she just recently was promoted to the head of the CIA group. She said she intends to collaborate with Broward Health, and she has. There's a shared goal of successful completion of the CIA requirements. Then she said she's worked with a number of compliance officers in all of these numerous CIAs that she's been involved with. She said she has, and these are quotes, great confidence in Nick. She thinks he's doing a tremendous job, and she sees him as very committed to getting these compliance issues behind us. And then she said, she knows Broward Health has challenges. She's given it considerable leeway, but her patience and the patience of the OIG is thinning now. She said compliance is not the responsibility of Nick's department alone. Compliance is the responsibility of everyone from senior management to hourly employees, that the compliance department can't be vested with investigating and uncovering every non-compliance. That's everyone's responsibility. And then she said you can't avoid compliance requirements because of expedience or need to complete a task timely because of delays for whatever reason. And finally, she said she's concerned with the changes that had taken place in the earlier part of this year. They didn't sound good, and they have delayed certain of the reporting requirements, which I think is exactly what Mr. Hartfield was talking about when he didn't get the January 17th, and it was delayed until August. So that was my conversation with Ms. Ellis. She wants everything that's good for us. She wants us out of the CIA as badly as we want out of the CIA. But it was a warning that we really need to tighten down. And finally, the IRO report. Compliance is still reviewing the IRO report, as is legal, and we will report on our review of it next month. Is there anything?
Yeah. So I mean, I'm happy to hear that corresponds, but I'll give you a perfect example. So I hear that her department's patience is thinning, right? If you would have told me that I would have been surprised to have heard that. I'm just being honest. Like, I was under the impression we were doing what we were supposed to do. We were on task. We were on, chronologically on schedule. Yes, we're a big organization. Yes, we have issues, and there was no feeling that I got, at least, that there was any reason to be concerned, let alone actually having concerns. And I'm really not trying to be an ass, I promise you. I don't like feeling like I'm going backwards on some of this stuff.
My sense is it originated with the IRO letters.
Well, I don't know. All I know is I'm not in her mind, and I'm not trying to be.
Right.
I'm just saying my general feeling was we were moving along whatever glide path we should be, and we're doing a great job. And I don't believe that you aren't. I'm not suggesting that you aren't.
Right.
But I think it's safe to say we just got to be better, right? And so how do we get better? And, look, if I'm just, all I was saying before is if something needs to be clarified, then we clarify it. But it can't be just, you in a vacuum. You can't do it all on your own. And I think that's her point too, right? So, I'm not 100. All I'm saying is I'm just telling you, I felt like I went backwards, and it's like,
So I will say this.
It's like the third rail for me.
Because I was not on the phone call with Commissioner Gregoire. But in the past, when she's made similar comments about her patience thinning and the OIG's patience thinning, it's in regards to our contracting system, which I spoke about at the last board meeting. Of the one big concern that I have as Chief Compliance Officer is our contracting system. We're required under the Corporate Integrity Agreement to have all focus arrangements in one single database, and the accuracy of that information is sorely lacking, which I explained at the last board meeting in July.
That was her reference about the changes that she said doesn't sound good.
So, because I spoke about it at July when we were talking about, because I said that was my one concern when the IRO goes to request, which they did the other day, right, the list of all focus arrangements for their transaction review. And that's really my biggest compliance concern right now is the contracting system.
No, and you may remember when we went from Metatrack to.
And I do. But I do feel like communicate that.
No, I understand, but I expressed a lot of concern back then.
Yep.
About the idea that in the midst of all of this, we're going to go from this system now. Of course, there was imperfections with Metatrack or whatever. I understood all that, but I think I made the point at the time that somehow, some way, we got to figure out how we're going to, at a minimum, maybe have redundant systems, because there's got to be some checks and balances, right? And look, we can't go backwards. The decisions that were made 2+ years ago, in many respects. But here's where I'm feeling Ms. Ellis is coming from, and I'm just speaking for myself, okay? How long are we going to be able to say, well, we switched from Metatrack to some other system and we're having problems, right?
Yep.
I don't know. it just,
I
I'm
think that was-
growing more and more
That was her
concerned.
point. She expected.
I agree, obviously I feel the same way, so I can't disagree with her. Right?
I don't either.
We just gotta buck up and get it done. I don't know what else to say.
I've heard that since the beginning about 360. What are we doing about it? Who's in charge of it?
Now,
So I know it works at other facilities. So should we be looking for something else?
I think if we're going to talk about contracts, I think we need to talk about what Commissioner Yuri started with is before we got here, we decided to move Meditrack to C360. I personally would not have moved a centralized contracting system when it's a requirement of the CIA in the middle of a requirement to a new system. However, I think that the old organization or whoever was the compliance officer felt that this would provide better functionality for the organization. So we did it. The person who was in charge of the transition is no longer here, and he just messed up the transition. He didn't pull everything over. He didn't do it in test. All the contracts were all over the place. I quickly got here, identified that it was a significant issue and a significant risk to the organization. I had to hire in a director. I had to hire in a manager. I had to hire in contracting staff that was just dedicated to the department. Before we started this process, there was 4 people dedicated to it. We now have 20 people dedicated to getting contracts through. Just to give you some perspective, I know you think Jackson, we just said, is a little crazy. They have 3. We have 20. Okay, I had a choice to make. Do I, at a point in time, say whatever happened in the conversion was bad, but it's somewhere in C360. It's not very easily identifiable, but it's in the system. Do I go back and take those 20 assets and move on those old contracts, or do I say, okay, all the new coming in, we're going to process the new coming in, and as we go through the bottleneck, we are going to go back and fix the old contracts. So no matter what I do, you guys are going to say I'm not doing a good job. If I leave the current contracts alone, then we don't have quality care, we don't have coverage, and then you have physicians coming to the board meeting saying we can't get a contract, blah, blah, blah. So I chose to move forward with the new contracts, and we've been working slowly. We tried a solution to bring in an outside consultant type of deal to come in, read the contracts, and get them organized. It did not work. They weren't skilled enough. They weren't able to understand the system enough, and we quickly identified that it wasn't going to work. So what I had my contracting department do for the last 4 weekends in a row, 5 weekends in a row, constantly until they get it up to date, is come in on the weekends and go through each one of the contracts. Is it working? Yes, it's getting better. Is it where Nick wants it to be? No. But you have to remember, I came into just an absolute disaster. They just did an audit prior to my new process and prior to the old process. And the old process had, I would say, a 65% error rate on it?
I think most categories had at least like a 40 to 50.
Yeah, and the new process had, I would say, 5 to 7 fallouts in the entire process of the contracting they did. Now, it's a small scale, but it's getting better. Since we changed the process around, we processed over 850 focused arrangement contracts and service contracts through that process at a time of just under 2 months. We started at 9 months. So I don't want to talk in contracts, things, this and this. I'm talking on facts, and the facts are that it's getting better. Is it perfect? Is it where Nick and Lynn and we want it to be as a team? No, but it's getting better, and it will get better. Each day it's getting better. And that's what I've committed to this thing. You just have to understand it was a bad conversion, and we can't move back on the conversion. I can't do anything about that.
But with that issue behind us, I think Ms. Ellis will come off her, we're not pleased. I think that is her issue.
In the past, when she's made similar comments to me, that's what it's been referencing, right? Because promises were made by the previous contracts department personnel of it's going to get done on this date, 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 and here we are.
Well, that brings back, again, we can't go back, and I can't undo your self-imposed deadline. My suggestion to you is maybe not do self-imposed deadlines.
Well, no, I didn't create those deadlines, right?
Well, I'm referring to the
contracts
self-imposed deadline that you
Yeah.
We're stating, and and when you are, especially when you are not going to
Bless
meet
you.
those deadlines, you need to have some correspondence with the board, with Commissioner Gregoire, with senior management, and most importantly, Miss Ellis. Hey, I know I told you it was going to be January 31st. I was really aggressive in putting that deadline together, and I'm not going to hit that deadline, and here's why. So, as opposed to waiting 8 months or 7 months for her to say, hey, where the hell is the report you promised me January 31st? You understand what I'm saying?
I do.
I just want to say a couple questions. Alan, I don't think anybody, I think you mischaracterized yourself there. I don't think anybody's saying that no matter what you did was wrong. I think it's a huge problem, and I think you're trying to tackle it. I know there was an August 31st deadline, which I presume we didn't meet. What is our next? Well, I mean, where do we stand? If you would have looked at it and said you put a percentage basis, are we 75% there? Are we 80%? Just so we have a sense of where we are.
So the August 31st, I think we did meet for the majority of them. It's a hard question to answer, and here's why. If you read the CIA, it says you have to have a centralized database.
Right.
Okay, so by the letter of the CIA, we have a centralized database for our focus arrangements. Now, when you start to ask, how is the IRO going to audit?
How anyone would.
How would anyone audit it? Okay, you go in there and you want to pull you want to pull the call agreements, okay, and you want to audit those. Okay, that is very difficult because if you're going to pull call agreements, that field then it transfer over right in the 9,000 contracts, so that's not 100%.
Right.
They just asked for a focus arrangements. What we had done by the 31st was we had was it a focus arrangement, yes or no? Was it an auto renew, yes or no? What was the term of the agreement, and what is the name of the agreement? And the other thing they updated was what type of agreement. Those were the 4 or 5 things out of the 2,700 focused arrangements that they focused on and got done by August 31st.
Okay.
So that report that Nick was asking for the IRO, that was produced. Now, if you're going to go in there and ask other things like what is the rate, does it match? No, probably doesn't. So there hasn't been a timeline established from what our contracts director told us, but that's where we're at today. So
I understand we have a lot of people working on it.
That probably doesn't answer your question.
It's okay. Have we exhausted all of the opportunities to bring in resources to fix this? I mean, if the Compliance 360, do they have a recommendation as to somebody that we could contract to bring in to help you get what you need? If you need resources, you need money from us to approve it. Let's just get it done. And if we have to spend money and time, let's do it. I know you've tried, but I'm saying I think this board is willing to say, hey, have we exhausted every avenue to get this done? Because I think if we get this right, I think it takes all the pressure off of you guys on this particular issue.
And I appreciate that. And the problem is that, and I think Nick and Lynn and Gino, it's just not a let's bring in somebody off the street and do it. It's somebody that has to be very skilled in knowing our contracts, reading each appendix, figuring out, and then putting it in. And what my contracts person said is that it's just better off for her to come in and do it herself because she knows how to do it than to bring somebody else in who is basically asking questions all day long, and then it's counteractive to what she's trying to do is what she has told me. That's where I would bring in anybody I would have to bring it in to get it done because I want this off my plate.
Right.
What I can guarantee you is that payments are not going out because we have a balance with POs, and payments are not being made to focus arrangements that don't have an active contract ID. So as somebody goes to initiate a payment and there's no active PO, in order to get an active PO, you need an active contract, it stops, and then we search for the C360 and it gets updated. So it'll all bleed itself out over time because as the contracts expire, they're going to have to get a new contract, so that would take that away. Or if they can't get something paid to a physician, we would have to go into C360, look for it, update it, and move on. So it's a hard. You're asking us to do, like, if you want me to hire in consultants, it didn't work. I guess I could hire in attorneys to sit there and
No, I don't know because I've never looked at Compliance 360, and I'm never going to look at Compliance 360 because it's not my role and that's my response. I'm just saying I think there's a willingness to support what you guys need to do to get this done. And I guess, and to Gino's point, that search fields, right? So that's a design implementation of Compliance 360 on our system. I mean, do we have people working on getting the fields that you're looking for and getting that completed? So as every new contract goes in the system going forward, we'll be able to retroactively go back and do those searches for the things that we know we need to be able to, that we can't do now. Because that was my understanding is Compliance 360 is there, but we need all these other search fields that haven't been implemented on there because it wasn't done during the transition.
They're there. The search fields are there, but they just were not. They didn't cross over properly. So the new contracts going forward, if I do a contract today at 360, they're implementing the search fields correctly going forward. It's all the other 9,000. Well, let's focus on the 2,600 focused arrangements.
Mm-hmm.
There's probably, I would say, close to 60 fields in there. They focused on the 5 fields that I said so that we can query it properly. So to your point, Tia, who's our director of contracts, told me she has a list that manually explains what the errors are, but they still need to be able to retroactively go back and change those.
And it's a vulnerability, right? Until we get those fields fixed. I mean, there was an example in July to where a physician got paid on a contract that expired.
Right.
Because in the system it showed it was effective. But when you went and read the contract, it wasn't.
I mean, is this, okay.
You know, and it wasn't until the site found it, right? So Gino asked his people at the sites to go through, read your contracts, right? Know what you have. And when they did, that's when they discovered that 360 showed a contract that was active and effective till next year when it wasn't. It was listed as an auto-renewing contract and it expired.
The other thing that's manual, to your point, Nick, the other thing that's manual is in 360, and as we're going along, we're figuring this out, right? So in 360, let's say that all the fields are correct in 360. Well, guess what? We're not sure that there's a fair market value for the auto-renew ones that continue and that are accurate.
Okay.
So now we're going through and we're terminating all of the auto-renews. So as we go along, we're figuring some of this out.
And I think each day we, with compliance and legal, find things that we didn't think about should go into C360, should it not go into C360? How do we workflow this? Like the finance managers for the investments, like that, we put that through C360. So we're growing, we're starting to say, oh, hey, we need to put this in there. But it is much better than it was 8 months ago, and each month it gets better and better and better and better. And that's going to be my commitment. And whatever you guys need me to report on statistics or where we're at or audits, I'm more than happy to. It's not where it needs to be, but I'm actually very proud of that team, and they get beat up a lot, and they're working their butts off, and we're working really hard for this organization.
Look, we're certainly not the first organization that did a major conversion of technology from system A to system B, bringing all the data that's had a problem. We are certainly not the first, and we will not be the last.
Yeah.
I think our responsibility is make sure that that you guys just focus on it. If you need something, come to us. That's all I'm saying. If you need resources, just come to us and let's just keep focused on getting it done. And we get it done to make everybody's life a little easier.
Let's not think that she's just frustrated with Compliance 360.
Right.
The IRO issue I would imagine is a frustration. Our response, our partial response, which I don't believe we should send until we have a complete response, was received, right?
But that wasn't our response.
I know it wasn't our response,
but executive management response.
But she got that, right?
Yes.
That's not a good idea. I mean, that response should have been one uniform response.
You said you were going to send in the annual report.
She got that
We'll
response.
send our response in the annual report, yes.
We didn't send it.
She
got it.
She got it.
Who sent it
Right?
to her? My impression was that she received it because there was an information request on everything that had to do with the IRO from a certain time period to a certain time period. Since that came out before that was done, my understanding was Lucia took that and sent it.
Regardless of how
part of the data request.
regardless of how she got it, I read it. Parts of it I liked, parts of it I didn't like. I would not, as a monitor, have liked to get a partial response like that. That doesn't deal with everything in there. We also have another body that's actually looking at the rest of it. I think the IRO report was one. Our response should have been one uniform response that was partially made up of what you all were doing, and we're doing it. If you think she's just upset about Compliance 360, my point is that's not accurate. If I were her, I'd be frustrated with that response. One, because it's partial. Even if it was accurate, it's partial. It's not a complete response. And two, that we're taking as long. Hopefully, we'll have it done, the rest of it done, and we can send one response. I would say that we don't have multiple. I guess what you're saying is it wasn't intentionally communicated. It was part of a records request. I would say that it shouldn't go unless it goes to our compliance departments.
Part of the IRO report criticized not producing information. There was an additional data request for the IRO, which included anything that had to do with the IRO response. That response existed. I'm sending it. So I sent it to Lucia. I'm assuming she sent it out. Actually, I didn't
I'm
send
sure
it to her
she
because I
did.
didn't have it, but I told her it existed. So I'm
This
sure
is
she sent it.
exactly, Commissioner Berry, you put your finger on the problem here. Is we're not operating as a team. Right? We're the board, you're the compliance officer, you're our general counsel. The IRO sends a letter that has inaccuracies in it from July 23rd. Right? So in my opinion, it did. But I've expressed that before, and he wrote a letter back indicating his response. So I think at the end of the day, we're now in year 4 of the corporate integrity agreement, right? There's been a lot of progress made. We haven't cured everything, right? In our system, we haven't cured everything. In our compliance, we haven't necessarily cured everything. But if we don't start playing together and cooperating, we're not going to get there. And what I'm seeing from the past, just the last couple of months, is a lack of teamwork, a lack of cooperation between our management, our compliance, our legal, and this board. And that has to stop. There's failures of communication. If I get a letter from the IRO and it says we're aware of these problems, we've just had compliance committee meetings as a board, we weren't advised of those problems, that's an issue. You're our compliance officer, you report to the board. You need to tell us, hey, board, I'm aware of some issues, I need to bring these to your attention.
That was
These are
Miss
things-
Ellis's point. Miss Ellis said Mr. Hartfield is not in a position to uncover everything. We weren't aware of them.
That's correct. And when you report to
And
the
I
board,
wasn't aware of them until I saw the letter
you weren't aware of what?
of the issues disclosed in the letter, like
In
the
the IRO
IRO.
letter.
No one ever reported anything to the compliance department.
So in the July 23rd IRO letter, you were unaware of any of those issues
No.
prior to that July
And we're
23rd.
assuming
Other than
that
meeting
that-
with the IRO and they asked me my involvement with it.
And
Okay,
we're
so-
assuming
but you
that
had
that was a
communication with the
negligent
IRO.
failure
Yes,
to
because they
disclose, not an
interviewed me
intentional
related
failure
to it
to
and
disclose.
requested it and did a data request.
All right, so when
But
did you
what the
first?
specific
all right.
allegations
Well, I didn't know
or
this.
anything
So
like
when
that?
did you first get communication from the IRO regarding this issue raised in the
I'd
July
have to-
23rd letter?
I'd have to look at them. I don't have it here in front of me.
Well, to the best of your recollection. I mean, it's only 2
I
months
don't
ago.
feel like doing best in my recollection.
So you don't want to answer that?
I will more than happily answer it once I look and see when
Was it
the
a
date,
week?
when
Was
the
it
dates
2
of
weeks?
the
Was it a
letters,
month?
when the dates of the letters were sent,
Nicholas,
stuff
was
like
it,
that.
was
I
it a
am
month
not
before? Was it a week before?
of the July 23rd
Yes.
letter. It was sent. They sent a data request the Friday before July 4th,
Okay, so the end of June.
whatever date that was.
Okay, so the end of June, so about a month before, 4 weeks before.
Right.
Okay.
But there was no specific allegations outlined in that. It was just a request. Please send us the data for these contracts. Here's what we're requesting.
Okay, and I believe that we had meetings between then and the July 23rd date. I could be mistaken, but I believe we did have a compliance meeting in there. Again, if there's issues that you become aware of, we need to become aware of them. And particularly if there's inaccuracies that may result from a failure of having a team effort in responding to those, that's a problem. Because now we have a situation where you have an IRO report, which may or may not contain inaccuracies. We then had management who had to respond to that.
Right.
Right. So now there's a question of, well,
where all of management wasn't included in that response.
Right. And
so.
Right. So who's cooperating and who's not?
Nothing was
So-
communicated. Nothing was communicated to
What do
me
you
about
mean by
what went to
that?
the board.
No, I can clarify
We
that.
were
Nick and
asked
I
for
were
management.
Hold on. One
One
at a time.
That
Nick
is
and I were
true.
not part of whatever executive management signed the letter, which was not signed by individuals. So it's senior
Which letter are you
management.
talking about?
The letter that was written by
To the
whoever.
board dated
To
August
the-
15th.
about-
The executive,
correct.
so that would be, Commissioner Berry, you asked us in a board meeting to respond. So you asked.
To us.
That's right, so you wanted us to respond. So executive management, Gino, the three of us responded. I know that legal was going to also review it, that she had mentioned it. So you got our response. That's what you asked us for, our response, so we did. I know legal and compliance were going to respond as well.
So let me ask you a question. We don't need to have an argument. The letter that you sent to the board August 15th
Yes,
from executive management,
yes.
who is executive management as defined in this letter?
That would be, as I just said, Gino, Alan, and myself.
So is Nick and Lynn not executive management?
They were not, of course they're executive management. She reports to the board. I assume she is. I assume you refer to her as executive management and Nick isn't. But we were asked by Commissioner Berry. He looked at me and said, you and your team. So when he said team, I assumed this is my team. As you know, Lynn doesn't report to me and neither does Nick. This is my team. I assumed and made that's who he asked me to respond to. So I did.
And that's
So
I
why
assumed
does it
was
from
your
not
response.
say Bev Capasso, CEO, Gino Santor, Chief Operating Officer, and Alan Goldsmith,
I
Chief
assume you
Financial
would
Officer?
all know that when he asked for my team, you would know who the team
So
was.
my assumption as executive management is Nigel, is Nick, is Lynn, is you, is the rest of your
No,
team.
well, that's,
Well, and how come nobody signed it? Did you all write this letter? Who wrote this letter?
yes, we did. Yes, we did. Gino and I,
Alan, did you write this letter?
I was in London during.
Okay.
so
We
we,
were on a tight request, so when I was in London, Gino put together kind of my part of my letter. Because I was in the IRL and it affected me, and I wanted to make sure that my name was specifically clear. And if I was wrong, I was wrong, and I would take the consequences of it. So Gino, when I was in London on a business trip, put it together for me.
and then I finished
So-
it off.
But in terms
let
of-
me, Chair, please. I asked the question. I've let everybody talk. Okay. I asked the question. Who asked it?
So
Okay.
So upon my return, there was a letter. It was a lengthy letter. I specifically read the entire letter. I necessarily don't disagree with anything in the letter, but I really focused on stuff that was related to me because it was my name in the IRO report, and I had to feel like I had to really focus it on mine. And that was the extent of kind of my portion into the IRO. But I read through it, I understood it, and that's it. I don't, if it says executive management, it doesn't, I think we're talking, egos here, not necessarily what it was from. We understood the exercise from Commissioner Berry as this to give a response, and that's what we did.
Okay, Gina, did you write this letter?
I wrote parts of that letter. My contributions were largely related to, since Alan was out, I pulled the data that showed that they classified Alan as having a total complete disregard for the compliance and 360 program, which was not true. So I amended the record from that perspective. On the majority of the items in the IRO, which were related to contracts, I investigated them, substantiated them, and then wrote the action part in terms of us following education and progressive discipline.
Okay, and
And I took care of the rest. And then once we finished it, we reviewed it many times. It didn't just go out. The three of us, we reviewed it. We waited for Alan to get back so he can review his parts. So it was a conglomerate of the three of us.
so let me ask you a question. How come nobody signed the letter?
You know what?
It's a nebulous answer,
Yeah,
executive
yeah,
management.
yeah.
If executive management, the other
Because
three
I-
individuals should have seen this letter, but they didn't. So I'm asking why
So,
nobody
okay,
signed
so,
it.
because again, I thought it was understood when Commissioner Berry looked at the three of us and said, get it done. I thought it was understood. If it's not understood, okay, next time I send something, I'll make sure that we sign it.
Well,
That's all.
no, it's not a matter of being
No.
misunderstood because a lot of this letter says there was a lot of misunderstandings between myself in this
Right.
letter and your team.
That's
and
correct.
and the former HR executive. And there was clearly no misunderstanding. If you watch the video and listen and read the
I did
tapes,
watch the video,
okay, there
Commissioner.
should not have been any misunderstanding. So again, you're saying, why is there misunderstanding? This,
So that
like
would be your
this,
perception. That is not my perception.
well, I think
No.
there's a lot of issues in
Again,
here that are
that's why you
misunderstood.
got,
But I think that's fundamentally why this has been a bad process. So this IRO report was a distraction, and it was an unnecessary distraction in my view because it was misguided. And I don't think the IRO got accurate information from this team, from the system. And the IRO got information, however he obtained it, and ran with it and issued a report that I don't think was 100% accurate. And, and then he wrote back saying, I just looked at the documentation I was able to get. So, and that's what an attorney would do, saying, I looked at what I was given and I responded. So this has now become a huge distraction. It's something that I think can easily be cleared up. And I think that the management memo goes a long way towards clearing this up. But the point is we need to stop this. We need to stop this, miscommunication internally. If you receive something, you need to let us know. If you receive something, you need to let us know. And you report directly to us. So if you receive something, if you're going to distribute it, you're going to distribute it to all of us. To the management, the executive management, to the general counsel, and to the board. I don't want to see you taking something and sending it to one person and not sending it to the rest. So if you think it's something worth distributing, Nicholas, you need to distribute it to everyone, right? It's either you're going to review it yourself and then circulate it, or you're going to circulate it, but when it goes out, it goes out.
Okay.
I mean, is that?
Yep.
I think that's a reasonable process going forward.
It is.
I don't want to get something weeks later or months later, and I don't think the fellow board members do either. And this is what happens when we're not working together. So we need to focus and work as a team. And I think from the IRO's perspective, if I may, I'll relay that I had a meeting with the IRO last week, and she's comfortable with the direction in which the system is going. I was in DC. I took the opportunity to reach out to, the monitor. I'm sorry, the monitor at the Office of Inspector General at HHS, Laura Ellis. So I reached out and I said, hey, I'm going to be in DC. She said, great, let's get together. And we had a very constructive meeting. I think overall, she is satisfied that we're making great progress, and she understands that a lot of the issues that we've had in the past are in the past, and that the current team that's in place here is committed to fixing them. And we're focused on fixing them from the board level, from the executive level, from the compliance and legal department. So she knows that we're all focused on working on these things. She knows that we started at a bad place in terms of a lot of items to fix, and actually gave a lot of good feedback on how we can continue to move forward in a positive direction. So I think the bottom line in it, one of our fundamental points is that we do need to work together. So this is something that I was going to mention, and it was only reinforced from that meeting with our monitor, that we need to work together. And she specifically mentioned management, legal, and compliance together with the board. Now, the board has certain responsibilities, and we need to fulfill those. And she asked that we include that management response as an appendix to our annual report when we send that in. Because obviously this has become an issue, and she wants to know that it's been addressed, and whatever information is going to go is going to go in there. She understands that we're going to have questions as we go along, and if we have questions, or management or legal or compliance have questions, obviously I think it gets rooted through you or through Commissioner Gregoire most appropriately, but if there's questions that we have, she welcomes those. She wants to have that open dialogue so that if we say, hey, is it okay if we're doing this or that, that we're doing the right thing. In terms of the contracts, she understands that our contracting process was not ideal in the past. She understands that we've migrated to a new system, that new system created some additional wrinkles above what might have been anticipated 3 years ago when the CIA was entered into. But again, that it's being addressed and it's going to be effective. That's what they're concerned about, is how effective is our plan. And an effective plan goes beyond training. It goes beyond periodic reporting. It goes to the culture within the system. That's what she's focused on, and that's what we need to be focused on, so that everyone understands what those compliance obligations are, how they're being honored, and that things aren't falling through the cracks. And there may be something that happens that's non-compliant, but what they want to know is that when that happens, it's uncovered and it's reported, and that it's not a systemic issue. And that's what we need to continue to focus on. With regard, if I just want to wrap up the rest of the conversation, the hotline is a very important item she addressed. Everything that's in there has to be logged, and that when it comes to contracting, compliance can't be an obstacle. It's something that we have to do, but what makes sense is to have streamlined contracting procedures, and that's something we're working on as a board, to get template contracts in place so that everyone knows what the lead time is to get a contract done. So when you need to do a contract, you say, well, I need X period of time to get that done, because that's our process in order to make sure that it's being done in a compliant fashion. At the end of the day, it's a question of considering compliance and building that into essentially everything we do, not to make it an obstacle, but to actually streamline our procedures. And then when problems get found, that they're being addressed and that that recurrence is being prevented. So I think at the end of the day, we're in a good place in terms of the OIG, monitor understanding that we're serious about compliance, that we're serious about preventing the things that have happened in the past from reoccurring, and that we're all focused. But we need to do that as a team, and we need to do that together.
So at least from my perspective, I'm trying very hard to not look just over the tip of my nose here. Okay, we're in the back half at a minimum of the CIA. We're not always going to be under a CIA. We're not always going to have an IRO. And if I was, and I don't ever want to be, but if I was the OIG monitor, I would want to have some confidence that come the end of this process, that this organization not only is, checking all the boxes and doing all the things that, it's maybe listed there. Going back to your point about culture of compliance, I've said that multiple times. But you also have to have an organization that's able to address an issue itself, investigate an issue itself, take corrective action itself, and do so in a way that is with an eye on being compliant. How a situation like this circumvents all of that ability this was a perfect opportunity for this organization to demonstrate that we get it, that we can look at things ourselves, we can investigate, we can evaluate, we can be better, and we can take corrective action. How all of this stuff gets circumvented, I don't understand, but I can say with some confidence that is what we ultimately are going to have to be able to demonstrate. Understand? And so that's where some of the bigger concern to me comes, is circumventing any of our own ability to demonstrate that we get it, right? And to me, that's a perfect opportunity for the IRO to say, hey, they've identified an issue, they've investigated it, taken corrective action, and you know what? I'm really proud of them. It's a perfect opportunity, and that didn't happen here. And I think that's the type of thing we need to do going forward.
Right, but I don't disagree, and we do that now. Like, we investigate issues, we address issues, we correct issues. We do that constantly.
Just need to do them all.
Well, I have to know about it.
Yeah, I mean,
When I'm saying no one made an allegation to the compliance department related to that.
the issues in the IRO
So,
report were not because of
I'm just supposed
complaints,
to
right?
I can't magically know.
The issues in the IRO report had nothing to do with complaints, correct?
No.
So that it wasn't like somebody went to the hotline or filed a complaint or there was some kind of grievance.
No.
The IRO did an investigation, and what they found. Right. Okay, so I don't think it's a failure of compliance or that we're not. I think that when issues are brought to Nick, my experience has been he investigates them. He diligently pulls the data, interviews the people. If it's something that needs to be referred, it gets referred to legal. If it's something that gets resolved, it gets resolved. I don't see anywhere where a situation where Nick isn't 100% focused. I know that's been my experience. So I think this IRO report has nothing to do with our lack of compliance. It's not because we failed to respond to a complaint. It was found because the IRO does what the IRO does. It randomly selects and investigates things. I mean, the reasons the IRO selected those particular cases, I don't know. I mean, some of them are pretty clear why they did and why they were alerted to them. They were discussions that this board had at HR and at the board several months ago. They probably saw the report, read the minutes, looked at the video and said, maybe we need to look at this, and maybe that's how they came up. But I don't think it's a failure of our compliance procedures.
I'm not saying that, but if perfect example, if the IRO just happened to be listening to our or attending, he may have been here on the call, right? And he decides, hey, this is something I need to look at. Why didn't we decide this was something to look at? And you were at every damn meeting, as far as I recall.
Based on the
So,
meeting,
like,
representations were made that no work was started. So to my knowledge, nothing had occurred.
That was Miss Ellis's point. Miss Ellis's point is if people aren't forthright with the compliance department can't say, yes, you are in compliance, or no, you are not in compliance. His job is not private investigation. His job is you say to him, this is what's happening. Am I in compliance? And he says yes or no. I think we've said everything about 15 times, and I think we're growing. So in the absence of anything else, meeting adjourned. Oh, anyone move second?
Motion to adjourn?
Good. All in favor?
Aye.
Great, adjourned. Back to you.